those questions and expose us to many opportunities available in this field. But before we proceed, I would like to recognize and appreciate our zonal executives, national executives, departmental executives, our distinguished speakers, and every participant joining us today. Now, I'm going to take us briefly through the structure of today's program. Our first speaker will deliver a 30-minute presentation, which will be followed by a 10-minute question and answer session. And right after, our second speaker will also begin, same way. Without taking much of our time, let's move straight into the first presentation. Before I invite our first speaker, I'll briefly read his citation. I'm going to share my screen for everybody to see now. Sorry, can we all see my screen? All right. All right. Thank you. So while I read the citation, please let's make use of our virtual applause. Thank you. Mr. Olaide Kokola is a graduate of physiology and an emerging healthcare professional with a strong passion for cardiovascular physiology, clinical practice, and health education. He has actively participated in community medical outreaches where he has contributed to patient assessment, health screening, and public health awareness initiatives. Driven by a commitment to continuous learning and professional excellence, Mr. Olaide has a keen interest in bridging physiological knowledge with clinical application, particularly in cardiovascular health and disease prevention. He is also passionate about leveraging technology to improve healthcare delivery and has experience in web development and digital solutions for health-related projects. Please, I'm not seeing our virtual applause. Let's keep it coming, please. As a young professional, Mr. Olade is dedicated to mentoring, knowledge sharing, and inspiring fellow physiologists to embrace innovation, research, and lifelong learning in advancing the profession. With virtual applause, please join me in welcoming Mr. Olaide Popola. Thank you so much, sir. You have the floor, sir.
All right. All right. Thank you so much. Thank you. Thank you, our moderator. I'm glad to be amongst us, and I hope everyone can hear me. I hope everyone can hear me.
We can hear you clearly, sir.
Yes, sir. Okay, so let's go straight to the business of the day. First, I appreciate the leadership of I appreciate everyone who has brought this conference together. Well done, well done, well done. And I'm happy to be amongst us. So straight to the point, I've prepared a very short slide just to speak to us about physiology. Now, I know that a lot of us we have so much on our minds, like our moderator said. She asked a question that a lot of people have a question in their mind. And, sometimes, I think, was it last week or so, I was asking a physiology student and trying to ask him that, okay, what exactly do you want to do with physiology? But he finds it hard to, give me a response. And it's not actually his fault. It's just that he still do not understand, okay, what exactly he wants to use physiology for. And I know that, or I know that a lot of us, let me share a little bit of background. I believe that not so many of us usually apply for physiology when we want to get admission. Many of us put in for medicine and surgery, some nursing, some will put in for MLS and all. But somehow, most of us here, I believe most of us here, if not all, it can be all anyway, uh, just found themselves in physiology. And then you were told that, oh, physiology is a good course and is the bedrock to medicine and all that. So, but in between the line, you get stuck, and then you are thinking, what exactly is this physiology? What is what exactly am I going to do with this? And so you get stuck. And so that is why today I'll try as much as possible to answer that question. Okay, what can you do with physiology? How can you build a successful career in physiology? That's why you are seeing my page. I believe we all are seeing my page, the page. So it
Yes,
says,
sir, we
Yes,
can
sir.
see it, sir.
thank you. So it says building a successful career in physiology. Building a successful career in physiology. Okay, like I've been rightly introduced, my name is Popola Olaide Adeshola. I'm a graduate of physiology. And then maybe as we go on, I would share a little bit more about myself when we get to some other aspect. But I'm a graduate of physiology. Now, what is physiology? That's the first thing I want to just talk to us about. So physiology is just the study of how the body functions. I believe we all know that, and that's the foundation for medicine. Anatomy tells the structures, while physiology explains the function. So when you talk about physiology, that's how the body works. You want to know how the body works, how the heart pumps blood, how how your heart is pumping blood, how food digests in the body. So how your lungs is expounding, is contracting for you to breathe in, breathe out. So physiology explained that. That is what physiology is all about and is the foundation for medicine. Yeah, there wouldn't be medicine if there's no physiology. That's why most of the time they call physiology the bedrock of medicine. Okay, let me move to the next slide. Okay, so why physiology matters? Okay, what's the importance of physiology? Why does it matter? It matters first in healthcare, research, sports, public health, and biotechnology. Now, why do we say healthcare? Now, if you don't know, there's this thing that many people don't know is that if you don't know how something works, you don't know how if you don't know how something works normally, you don't know if there's anything wrong with it. So if peradventure, let me say, I don't know how I don't know how the art works. If it's doing something wrong, I don't know how to adjust it. So, and physiology is the one that tells us how it works. Physiology tells us that, okay, this is how the art works, such that if there is any contradiction, you could pick and say, oh, okay, something here is wrong, something here, just like I believe we will be taught in school, pain, something like pain. Pain tells us that something is wrong here, for example. So that's what physiology is. It tells us how is very important in medicine. That's the bedrock of medicine. It tells us how the body functions. So if you don't know how the body functions, you don't know what to do. You don't know when it is functioning abnormally. You don't know when it is functioning abnormally or when it is functioning normally. So the first thing physiology does is that it gives us a view of how the body functions normally. And that's why we said it is needed in healthcare. It's also needed in research. Now, if you want to make research about, let's say, a particular disease, how do you do that? You first start with physiology. When you first know what is normal, then you can make research on the abnormal. It also helps us in sports, public health, and biotechnology. Okay, I'll be very brief because of our time. All right. So I'll move to the next slide. Now, physiology has, let me just explain this because this might not be captured in this slide. Now, physiology has different aspects, most especially, I'm not sure most of us know that physiology have at least, let me say at least, that I can talk about for now is I can talk about physiology as three aspects. Basically, for us now, as students, that you must know, physiology as we have the clinical part of physiology, we have the sports part of physiology, which some people call exercise physiology, and then we also have, I'm just telling you three areas you can go to in physiology. First, we have clinical physiology. Second, we have exercise or sport physiology. Then third, you also have academic and research. You have first clinical physiology, exercise physiology, and then you have academic and research. Please take note of that as students, because this will be the foundation that will help you in choosing your career path or building a successful career in physiology. These three that I just mentioned is basic and is foundational. Of course, every other aspect can join to it, but those three they are the basics you must know, because this will determine how you go as student, how you move as a student. Now, when you talk about clinical physiology, now what does a clinical physiology, what do they do? Majorly, they are the ones that work, that you see that they want to work in the hospital. You know, many of us, when we got admission, you probably think that as a physiologist, all you can do is to work in the hospital. All you want to do, or all you wanted to do, all you desire is that, oh, you want to work in a reputable hospital. So what do clinical, so for such people that want to work in the hospital, this part is for them. That's what we call clinical physiology. That part is those who want to really go into, you want to work in the hospital. We also have exercise physiology, like I said. That is the part for people that want to work in sport aspect. I'll get there too. When I get there, I'll speak more, a little bit more about myself. Okay. So for people that want to work under clinical, majorly, when you talk about clinical physiology, in the hospital where we are placed, I'm a physiologist, where a physiologist is placed, they are usually placed in the Department of Internal Medicine. You have them in the Department of Internal Medicine. That is where they work. And what they do is that they work at places where they diagnose. So part of the places they work at, they work with cardiologists. That's cardiovascular physiology. They work with cardiologists. Um, sorry about that. Okay. They work with a cardiologist. They work with neurologists. They also work with let me see one other. Okay, they can work at renal units. So when you think of working in the hospital, what you are just thinking about is first the position, the place where you'll be placed is internal medicine. And where you would particularly work, like I said, for cardiovascular, for those that want to work with cardiologists, what you do majorly is that your role is to help them in diagnostics. Now, and that's why you see me write ECG here, ECG, electrocardiogram. And that is one of the basic tests with which the cardiologists used to diagnose heart diseases, any cardiovascular problem. So you work at the ECG unit. That is primary role. If you want to work with the cardiologist, that is where you would work. And what you use ECG to do is to diagnose diseases. I would also tell you what you must learn if you want to really work with the cardiologist, what you must learn, of course. But the basic is that you work where there is ECG. That ECG is used to diagnose heart disease. ECG majorly speaks of electrical activities on the surface of the heart. That is what ECG, that is what they use ECG. That when you are reading ECG, what you are doing is you are seeing electrical activities on the surface of the heart. So they use it for different diagnoses. Okay. So you also have EEG, which is part of neuro. Neuro, is a neuro test. We have something we call neuro cap to be placed on the patient head. So that is another aspect for those that want to go into clinical. Just take note that where the department you will work is the Department of Internal Medicine. And these are some of the places you would work: ECG, EEG, spirometry. Okay. So, and where are you supposed to work? You are supposed to work at a diagnostic workplaces. Like you have teaching hospitals and you have a specialist hospital. I'm currently working at Junior Osun Teaching Hospital. That is where I work, and I work at the ECG unit and also at the EEG unit. So those are the places I work. So when you want to go into clinical, you are going into the Department of Internal Medicine, and these are the places you would work. Okay. Now let me move to exercise and sport physiology. Number one, you say fitness testing, then exercise prescription, rehabilitation, sport and performance. Now, I'm such a lucky person. Would I call myself lucky? Because all of the aspects of physiology I want to mention for you today, I've been privileged to, work in almost in the three. Now, this fitness testing, this is exercise physiology. These people mainly, they really do not work in the hospital. Now, they really do not work in the hospital. You can work at sports center. You can work majorly sports. Let me just say sport. And you can also work work in a place where they do rehabilitation. Now, rehabilitation is just trying to correct something wrong. Okay. Now, when you talk about fitness testing, now presently, apart from my work at Junior Osun Teaching Hospital, I also work as a fitness coach of a football team in Ibadan. Yeah, legendary football team. I work as their fitness coach, like that. So what you do is that what we do is that for example, if anybody has to participate in any sport, if they have to, like my football team now, if anybody is to participate in any sport, you are the one who will first examine them to see if they are fit for the exercise they want to go into. So you examine them. I did my IT at a gym center, so I learned all this. So the first thing you do is that you examine them. We have different, you have different kits you can use. You can use at least number one, basically, you check their BP, you check their BP, you check, you check their lung capacity. Yeah. So the first thing for people that want to really go into sport, these are what you would do: fitness testing. Then you also prescribe exercise. Now, when people come to the gym, you see the way the world is going now. Everybody wants to be fit. Everybody wants to be fit. Everybody wants to look very okay. So sometimes you see ladies, our ladies want to do BBL. Actually, there is exercise that can produce BBL that I'm not sure that people know about. There are exercises that gives us six packs. There are different prescription. Some people come to the gym, they want to know, okay, some people want to build six packs. All that you need is to know the kind of exercise to prescribe for them. Some people just want to build a particular muscle. Now, and if you are going into sport physiology, please, you must take your anatomy serious. Actually, you must take your anatomy because you are building muscles. So you must take your anatomy serious, actually, if you are going into sport. So you do exercise prescription for the football team. I work as their fitness coach now. I prescribe exercise they are supposed to go through. So sometimes you have an exercise plan, a routine plan that you give to them. So also you also have rehabilitation. Now this rehabilitation, for example, you have stroke patients that are just trying to recover. Instead of that's probably the work of a physiotherapist, but they also come to you because you know about this thing, and then you I just use stroke as example, but other aspects of rehabilitation, they come to you that has to do with bone and all that. They come to you, and then you'll be the one to tell them the exercise. Like I think last year now, I had to work with a stroke patient, like I think for about 3 months, like that, on rehabilitation. So there are different aspects of this thing. So if you are going into sport, hello, hello,
Hello, sir. We can hear you, sir.
is anyone with me?
Yeah, we
Yes, we
can
are
hear
with
you.
you, sir.
Yeah, we can hear you.
I guess he has network issues. Let's wait a little bit for him to join back or to continue his presentation.
Okay.
So, good evening, everyone. I think we should use this moment to start noting our questions, to start writing down our questions as soon as he joins and finishes his presentation, so we can ask our question. He will be back soon. Thank you.
Oh, sorry, guys. So sorry, so sorry, so sorry. Can we hear me now?
Yes, we can hear you, sir.
So sorry. I've been talking, and I felt like people were getting what I was saying. And I just noticed that I was just asking question if anyone was with me. So where did you guys catch me on? Have we gotten, did you hear when I was talking about what physiology is all about? The study of our body function.
Yes, sir. You were talking about
Okay.
exercise physiology, that anybody interested in
All
exercise physiology should be
okay,
good in
okay.
anatomy. Yeah.
All right. So that is what exercise physiology. What you do is that I said I was I'm currently working with a football team in Ibadan. So all that you do as a exercise physiology there is that you do fitness testing, exercise prescription, rehabilitation. So last year too, I also worked with a stroke patient for rehabilitation for like 3 months. So what you do is that I was saying that people want to build muscles. Some people want six packs. Some people want to do BBL. Instead of going through that surgery, there are exercises you can do. So what we do there is that we can prescribe that for you. We can prescribe exercise for you. If you want to have six packs, you want to build a particular muscle, you want to come for flexibility. Yeah, people who dance too, people who are into dancing, they want to come for flexibility and all. So as a sports physiologist, you don't have to work at the hospital. You can have your own gym as well. So that's that about sport because I felt my time is almost up. Sorry that I'm hard to rush through now. Okay, the third one is academics and research. Okay, now in academics, you can go into lecturing, you can go into research, you can go into publishing and innovation. Now, for the teaching, of course, I'm not a lecturer, but I've had the opportunity to teach physiology students. Yeah, I love to impact people. So I think while I was in school and even when I left, I've been able to at least take some physiology students through their lectures. Okay. But you also have the research aspect. You also have the research aspect where are we still together? Let me be sure so that
Yes, sir.
all right, thank you. So you also go into research now. For example, you want to look at okay, what you want to research about a disease, you want to research about one abnormality or research about one organ. Yeah, we can actually discover something new about an organ. So you go into research. So these are the three major aspects that you should have as a background as a student. Now, for somebody like me, when you talk about innovation, that's why I said I will speak a little bit about myself. You see, I've been able to cut across these three aspects. Number one, I've worked as a sport physiologist. Number two, I've worked as I'm currently into clinical. And this number three, innovation. You see, that's part of what I was read about me. Now, I'm currently leading a team to to um, to build a app and of course a software that can we have issues with people have stroke because of hypertension and is an heart disease. So we're actually trying to build a app and a software like a wristwatch that can continuously measure BP. Actually, I'm currently leading that team that can continuously measure BP, and then it will have a threshold. We work with doctors, so doctors will set a threshold for their patient. Like, okay, once your BP reach 140, 80, then that thing will raise an alarm. That will raise. Of course, we have wristwatch that monitors BP, but none of them monitors it continuously. What they do is that it's only when you want to check, and a lot of people don't check their BP usually, actually. So is sometimes okay, let's assume I'm currently doing something now and I'm occupied. I will be like when I finish the work, I'll go and check my BP. But you just discover that sometimes some people just collapse in between the line. So what we want to do is that we want to actually build a wristwatch that will continuously monitor that BP. So if the BP reaches a threshold, like I said, maybe the doctor said it will be doctor to patient related. So if the doctor sets the BP to be 130 something, so once that BP reaches that threshold, there will be an alarm that will sound for the patient, and the doctor would also receive an alarm at his end to tell the doctor that, okay, something is wrong. So the doctor can reach out to the patient, advise the patient on what to do before something like stroke happen. So that is that. So research is not just about researching about it. You can also bring in innovation. You can also bring in innovation. All right. So now, how do you choose your career path? I've just mentioned three career paths. Like I've talked about clinical part. If you want to go into clinicals, if you want to go into exercise and sport, then also if you want to go into research, what do you do? How do you choose your career path? Number one is your passion, your strength, your goals, lifestyle, and mentorship. Now, when you talk about passion, what do you have passion for? Now, a lot of people want to work in the hospital, but do they really have the passion? Because when you also have to look at your strengths. Now, some people now, when we that we work in the hospital now, you have to know that working in the hospital is irritating. Actually, you have to attend to some patients that have one kind of disease. They can come with different smells, and of course, if you are someone that something irritates you easily, that's not good strength. That's not a good strength to work in the hospital. So you have to check what your strength is. Then what are your goals? What do you want to achieve? Me, my CV read, I've loved to work. I have really loved cardiovascular physiology. Right from the moment I got the admission, my focus was mainly on cardiovascular physiology. That was my major focus. That was my major. In fact, I I'm a Christian, so I prayed that my project supervisor would be a cardiologist, and he was. He is a cardiologist. So that is my passion. That is my passion. I've told people years before now. So that's why you see me building projects on hypertension, something related to the art. And that's just one of the, projects we are working on actually. Of course, I believe we'll be successful. And then we plan to also take in IT students to do all of those, to learn all of these things. Okay, so you have to check your passion. What do you have passion for? Me, I have passion for cardiovascular physiology. And then I checked my strength. Of course, my strength can cover all the three aspects I just mentioned. I love to attend to people gracefully. I was speaking to one of our students and I was correcting her about how to attend to patients. You have to attend to people gracefully. You have to be patient. You have to be kind. You have to have compassion. Those are the strengths you have to work in the hospital. It's not just that the patient comes to you and then all that the way you talk to the patient feels bad. So you have to be patient. You have to be able to tolerate different things. So that even though you have passion, your strength is important. Then number three, your goals. What do you want to achieve with it? What do you want to achieve with it? Now, my focus is always that I want to help. In fact, in all my entire life, what I've always been thinking about is how to solve art problems. Yeah, those are my goals. Those are the set goals. If it's not art problems, then I want to think along, okay, how can we solve blood related issues? But I've not really gone so much into that as I have towards the art issues. So that's my goal. I want to help people. And when you set goals, sometimes it's not about sometimes you will pursue it even if it's not rewarding. Because sometimes you want to go into research and all of that, and then you are thinking about the reward. Another thing you have to look at is also your lifestyle. Your lifestyle. Your lifestyle. Okay. Are you a kind of person that we have some doctors that if you look at in fact I've heard a doctor that literally did not even go into medicine. He finished medicine, but his lifestyle, he felt his lifestyle does not fit into it. And then he found another thing to do. People felt it's like, is it a curse or something? But it's not. That's just his own. He just feel his lifestyle does not suit that. Then another thing is the kind of mentorship, the kind of mentor you have. Now, if you have passion, strength, and goals, lifestyles that you have clear. For example, if your passion, your strength, your goals, and lifestyle fit into what I described earlier for a clinical physiologist and then for a exercise physiologist, then if it fits, you have to look for a mentor, the right mentor that can put you through. Not just that I used to tell a friend of mine, I'll say that nobody is self-made. Mentorship is important. You can't be self-made. There are routes that people have plowed, and so when you are going through that route, it becomes easy for you. Are we getting me?
Yes,
Okay.
sir.
All
Sir.
right. So
Sir,
after I don't,
um,
okay,
in the interest of keeping to our schedule, can you
okay.
kindly round up the presentation, sir? Thank you so much,
All right.
sir.
All right. I'll do just that now. So having identified your strengths, the next thing you need to do is you choose your IT internship based on that. If you, and for the schools that don't do internship is industrial training, choose it based on that. And also the network with people. One thing I want to say lastly is that physiology also now have something that we don't know. Physiology now has internship like the nurses and medical lab scientists do. Like after their graduation, they go for internship. Physiology now has, but our own is that you write a letter to the association, and then once you write the letter to the association, they will approve it, and then by that they will put in an hospital. So if you are going for your NYSC, NYSC will not. If you have done internship, NYLC will not post you to a school. They will also post you to an hospital. That gives you like 2 years experience. So, and I hope that with the little I've been able to say, sorry that my time was, my network went off and I couldn't get back to us. I just believe that this little presentation will be of good help to us. Thank you very much, moderator. You can
Thank you
have the
so
floor now. All right.
Thank you so much, sir. Thank you so much for this insightful session. I already have a page full of notes. Thank you so much, sir. Now we'll
No
be
problem.
taking questions. So if you have any question, kindly drop it in the chat box. I know we have a lot of questions. Please kindly drop it in the chat box. So, sir, someone asked about space physiology.
Space
She said,
physiology.
yes. She
Oh,
said, what about space physiology?
okay. All right. That's a good question. Okay. What can I actually say about space physiology? Okay. Um, the reason why I didn't really mention about space physiology is because I don't really know much about the opportunities here in Nigeria. That's why I didn't talk about it. Okay. But for space physiology too, what you need to do is that when you look at that space physiology, let me gather it into this word, okay? Space physiology is basically how your body reacts when gravity disappears. So that's how your body works. And of course, there was a time I was doing a research on space physiology actually because of what Elon Musk is building, okay? Because that will be needed in the future actually. If Elon Musk succeeds in this mass project that is building, space physiologists will be needed. That's for the future anyway. Thank you for that question. So, so what happens is that without gravity, what usually happens is that your blood pulls down. Your blood pulls down. Gravity is how do I explain this now? Ah, okay. Okay, the person that asked the question, okay, maybe you should just get what I need to just explain about it. Just take it for the future. I didn't plan that for this presentation actually, so and I don't want to take too much of time, but plan that if you can, maybe if you can take note of the person, the moderator, and the person can reach out to me, I'll be able to answer the person's question very well. But it's a good one for the future. I was actually making research on it because of what Elon Musk is building, and it will be a good something for the future actually. So I would answer the question maybe personally or something like that. Thank you.
All right, sir. Thank you so much, sir.
Yeah.
So someone has another question. Apart from the three career paths that you mentioned, sir, I was told that they are hard to come across in Nigeria. And how can we get the mentorship for each career pathway?
Okay. Now actually there are mentors that you can get. It's just that many of us don't know. The reason is because we mainly in our schools, the people we meet with our lecturers. Are we still with me? Let me be
Yes,
sure.
sir, we are with you, sir.
Hello.
Hello,
So the
sir, we are
reason
with
is
you,
because
sir.
we meet most of the time with our lecturers, and so we think that maybe all that physiology is about lecturing and all. But we have people outside. For example, someone like me now, I've been into these three different aspects, and I've been opportune to mentor students that are maybe close to me, that probably I have their information. So you can actually you can go to there are different pages. You can join SPAN, join this Association of Practicing Physiology. So when you join those people, you can join, you can search for that Association of Practicing Physiology. You can join those. In fact, some of the physiologists that we have, we have some physiologists here in Nigeria that even do surgery at some hospitals, like for example at Luth. So we have practicing physiologists actually. So look for all of those pages and join them actually. So when you join, you can get mentors from those areas. I hope you understand that.
Yes, sir. Thank you, sir.
Okay.
And we'll be
All right.
taking one question more because of our
All right.
time.
All right.
Someone asked that, can one practice both exercise physiology and clinical physiology?
Yes, you can. For somebody like me now, I'm practicing the two. But let me add this to you. For some of us that want to go into clinical physiology, what you must also do is that you must be very technical in interpretation. So, for example, if you are going into clinical, learn how to interpret ECG report. Are we together? Learn how to. Are you with me? Let me be
Yes,
sure.
sir, we are with you, sir.
Learn how to. There are courses you can take online. You can learn how to interpret ECG report. So don't just sit down until probably you graduate from school. Get courses like that. How do you interpret ECG so that it gives you edge? Teaching hospitals now within Nigeria, before they don't take physiologists. Now it's becoming a must. Alakija is a physiology that is handling their ECG, UCH. All the teaching hospitals we have now are being handled by physiologists. That ECG aspect. So you learn how to report. It gives you edge. Learn how ECG report. Learn EEG reports. Those are the aspects you have if you are going into clinical. The other one, exercise. You can do the two together. You can. I
All
hope we
right,
got
sir.
you like that.
Thank you.
All right.
Yes, sir. Yes, sir. Thank you so much, sir. Thank you so much, sir, for this insightful
You're most
session. We
welcome.
really, really appreciate, sir.
Thank you too for having me.
Without wasting much of our time, we'll dive right into the second presentation. And the structure of the next presentation is going to deliver a 40-minute presentation, and there will be a 10-minute question and answer session. So I'll be reading his citation now. And please, let's make use of our virtual applause. Thank you. Can we all see my screen?
Yes.
All right. Thank you. Dr. Richard Adedamola Ajike is a lecturer in the Department of Physiology, Faculty of Basic Medical Sciences, Ladoke Akintola University of Technology, Ogbomosho, Oyo State, Nigeria. He holds a BTech in Physiology from LAUTECH and MSc in Physiology from the University of Ibadan, where he graduated as the best graduating MSc student in 2018, and a PhD in Physiology, also from LAUTECH. Please, I can't see our virtual applause. Let's keep it coming. Thank you. Dr. Ajike's research is centered on reproductive physiology with a particular focus on testicular ischemia, reperfusion injury, and testicular torsion. During his doctoral studies, he and his supervisor developed a novel experimental model for the induction of testicular torsion, designed to more closely approximate the clinical presentation of the condition in humans. Let's keep it coming. Yes, I can see our virtual plus. Thank you. Building on this model, his work has explored pharmacological strategies to mitigate the rapid and often severe consequences of testicular torsion. He has authored and co-authored numerous peer-reviewed publications in reputable local and international journals, and his expertise has led to frequent invitations to serve as a peer reviewer for manuscripts in his field. He is a member of the Physiological Society of Nigeria and continues to supervise and mentor undergraduate students in physiological research at Lautech. With virtual applause, please join me in welcoming Dr. Richard Adedamola Ajike. Thank you so much, sir. The floor is yours, sir.
Yeah. Good good evening, everybody. Please, I hope you can hear me.
Good evening, sir. We can hear you, sir.
Wow. Good evening.
Yes.
Wow. Good evening, everybody. I'm happy to be with you guys, and I hope you can hear me. And first and foremost, I want to appreciate the leadership of this program, who deemed it fit to actually invite me for this program. So I'm so happy and glad to be with you. So thank you very much. I hope you are with me.
Yes, we are with you, sir.
Right. All right. So before I go ahead with the presentation, I want to share my slide with you people so that you'll be able to I'll be able to communicate some of the ideas I've got concerning the topics and other things I would love to discuss and share with us. So I want to share my slides now. All right. Okay. I hope we can see the slide now.
Yes, sir, we can see
Hello?
the slide.
All right. Yeah. Thank you.
Hello, sir. We
very
can
much.
see it, sir.
All right. Thank you very much. The topic I was given to discuss with us is leveraging COS experience for academic growth and career development. All right. All right. And first and foremost, I want to appreciate us because there was an adage by this great Prime Minister of Israel that says that when a man has a vision, it shows that he's young. So what he said is that no matter the age of a man, when you have a vision, it shows that you are young. So I'm happy that we are here today to have access to information like this that can shape our life. So here is my outline, giving us the short history of what COS is all about. Because most students don't really understand what COS is all about. In fact, a lot of students they don't really know the importance of COS. They just felt it's a program that you just attend, or probably you can to a shop where you learn sewing, and after maybe the 4 months or 5 months, they will just come back and copy another person's report and present something. But this presentation, at the end of everything, will open our eyes to the fact that we will be causing ourselves a lot of disharm. We will be causing ourselves that we are following. So in history of COS, where and how to find placement, then the significance of COS to, can you hear me? Hello?
Yes, sir.
Hello?
We can hear you, sir. Hello,
All right,
sir.
thank you. All right, thank you. Thank you so much. I just want to confirm if you are hearing me. Now, what is CWES? CWES simply means student industrial work experience and experience scheme. And this training was actually incorporated by the federal government some years ago when they found out that some of the graduates the university are producing, they have only theoretical experience. And they found out that by the time they incorporate them the into the industrial world, they found out that they are not able to balance the theoretical aspect they've got during their training. They are not able to mingle up to mix it with the practical aspect. They were not actually able to meet the need of those industries that actually needed them. So that was why the federal government now thought of what can we actually do such that by the time these students are graduating, then we'll be able to what? They would have got more than enough training to function in the industrial world. So that was what actually led to the essence of the federal government bringing up sideways. And actually, this program was to build students in the aspects of familiarizing them and exposing them to the use of equipment and machineries. Because in the outside world, it is not theory that people understand. What people understand in the outside world is what? Is the practical, how you can use your equipment, how you can use your machineries to solve problems. So they found out that there was actually a gap between this, and they cannot translate that theory to what is tangible practically that will solve people's problem. So that's why sideways is like a bridge between classroom theory and real practice. What do I mean by classroom theory? What you are teaching in the classroom. This is the respiratory system, the mechanism of breathing, during breathing, this happen. But in the real practice, be able to use the equipment to actually check
Hello, sir. Probably he has issue with network. Please let's wait a little bit for him
So
to
definitely
come
that's
back.
what he has. There is a challenge with his network.
Yes, sir. So please let's be patient.
All right. Hello, please, are you with me?
Yeah,
Yes,
you
sir.
can just go ahead.
Yes, sir.
We are fully with you.
Sorry, it
We
was
are aware of
actually a
the
glitch.
challenge.
All right, all right. Thank you so
Just go
much.
ahead. Just go
So,
ahead. Yeah. Thank you.
all right, all right. Thank you very much. So, it was actually designed to actually meet a particular need at that point in time, and that need was to build students that will be able to meet the industrial need and requirements. For example, in physiology, we have been taught different things: general physiology, nerve and muscle, cardiovascular system, respiratory system, reproductive system, blood, and immunity, and the likes. So if this program was not properly explored, we will have physiology graduates or people that will graduate from physiology. By the time they graduate, they will not even have any knowledge. They will not have knowledge, on probably how to apply all these things in order to meet the needs of people, in order to solve a problem. Because we know, all as we've all known, that the essence of everything is to solve a problem. So in 1974, officially presented and approved by the federal government of Nigeria. And in 1978, ITF withdraws direct funding as financial commitment becomes unsustainable. They felt this program, we are not able to sustain it because of the financial need and the likes. And then in 1979, the NUC was saddled with the responsibility of managing it. So as time comes by, in 1984 and 1985, the management was actually handed over back to ITF, which actually resumed full responsibility of monitoring the program. And today, CWES is actually a prerequisite for students virtually in all disciplines. It is a requirement. And that's why for some of us that we have gone for IT, we see that 400 level second semester is meant for only IT, and it is a semester on its own. So in most schools, if you are not qualified for IT, automatically it is extra year because your program has not completed. That is the way the law sees it. That's the way university sees it. The university sees it as though you have not actually gone through the training. So the training was not actually designed as a burden. It was actually designed to meet a particular need in the society. It was actually designed to garnish and equip the students to be able to meet the need, the requisite need, to be able to meet the need of the industry by the time they graduate from the university. So that was the essence of IT. Then significance of IT, the significance of this CWES program to academic development. Number one, it reinforces our knowledge of coursework. What do I mean by it reinforces our knowledge of coursework? For example, when you go for your IT, for example, during my time, I did my IT at a diagnostic center. That was where I was exposed to it. In fact, that was where I learned how to use microscope then. All right. I learned how to use microscope. I learned how to run assays. I learned how to use autoanalyzer to run assays. In fact, I work in a clinical chemistry department where all these electrolyte tests, different tests, and all that were carried out. So I now got proper and better understanding, and I appreciated some of the coursework we have done properly. I got it properly. I now understood it well, that wow, so this was what we were being taught then. So the essence of IT is to reinforce the knowledge of our coursework, is to bring that coursework very close to practical. Now make us to understand, wow, so this was actually what they were talking about when they are talking about blood. So this is what they are talking about clumping. This is what they are talking about agglutination. This is what they are talking about this. This is what they are talking about that. So you now have a clear knowledge and understanding of what you have been taught. So IT is to reinforce the coursework that we have done so far. It's actually to increase that knowledge. It's to actually bring it very close to our understanding. So that is the number one benefit and significance of CWES to academic development. Then number two is that it strengthens our final year project. Because most times after IT, the next thing is what? Project. And some of us, we have opportunity to do our research in various research centers. So it widens your knowledge about research. It widens your knowledge. It widens your horizon about it. It gives you idea of the project topic. It opens your eyes to the methods and also the procedure, various procedure that you will use in your project. Most times you would have gotten most of it during your IT program. So that is also another benefit. So it strengthens your knowledge about the final year project. It gives you understanding. It prepares you for final year project, because some of the methods, some of the procedure that you are going to apply in your final year project during your IT would have been exposed to it. So with that, it will help us in that regard. Then thirdly, it builds laboratory and documentation discipline. For most of us that were on IT, we were given a logbook. And that logbook was not given to us, of course, for decoration. It was actually given to us for documentation. So it built a discipline in us. And you know that during my IT, I remember some of those procedures, I had to even document it in a separate note that was later helpful to me. Are you getting it? So all this exposure, they are building you gradually. And just as I've always told my students, that building a giant is not in a day. That's why I'm an advocate of gradual building. In fact, I used to tell most people that most of these disciplines we are talking about, they don't come in a day. In fact, you will think, I've not learned anything. But gradually, something is changing inside of you. Your mindset is changing. Your attitude is changing. Something is being built inside of you. And that is why when you graduate, you now find out that the way you were before you enter, you are now different. That is part of the discipline that is built in us. It helps us to document protocols. What do I mean by protocol? Most of these assays, they have a protocol that they follow. The technicians, they have a protocol they follow. So with the knowledge of IT, you build that discipline to document record, to report. And of course, I want you to remind you that as a physiologist, we are trained to be a researcher. And what is the major work of a researcher? A researcher is meant to be observant and to document information. And somebody will ask me, what is the essence of documenting that information? The essence of documenting the information is to provide an information that will be helpful to the society. So I kept on telling my people, telling my students, that the essence of everything we are doing is to help mankind. We are not just doing it for doing its sake, or we are just doing it to put it on the shelf. We are doing it to help mankind, to solve a problem. I was telling my current project, I said, who can tell me the essence of project? They were not able to. I said, the purpose of project is to solve a problem. So, for example, if you are given a project topic, for example, you are actually meant to, you have a topic, and that topic will have a problem. And you were surprised. Say, yes, the topic will have a problem. And the problem could be a reproductive problem. The problem could be cardiovascular problem. Then number two, I told them that the number two thing that the topic must have is what? The topic must have, after the topic having a problem, number two is that the topic must have what? Intervention. What do I mean by intervention? You have a problem. What intervention are you proposing to solve that problem? For example, I'm saying there's problem of reproduction now. This testicular ischemia reperfusion injury I'm talking about, it is a problem that people are exposed to. Most of the young guys that play football, during the process of playing the football, the scrotum, the testes can twist, and there will be shortage of blood supply to the testes, and that is accompanied by what? By pain, serious pain, and the person will have to be rushed to the hospital. That is the problem. Then there must be an intervention. An intervention simply means the solution to the problem. And then number 3 is what? The parameters that you are going to measure to confirm that your intervention has worked. So when you are given a topic or when you're working on a particular project, that project must have 3 things. It must have a problem that you want to solve, then an intervention that you are proposing, that this intervention will work for this and this reason. Then it must showcase us some parameters that you have assayed that will show us that your intervention has worked. Please, are you getting me? Please, are you getting it?
Yes, sir. We are with you, sir.
All right, thank you very much. So all these things, they are building a discipline inside of us. That by the time we get to the big stage, which is a big organization or in a place, with that discipline, you'll be able to solve problems. With that discipline, problem will be simpler for you to solve. Now, let me limit it to that. Then significance to career, just as the significance to career development. Number 1, just as I've said, you have the real work experience. In fact, some years ago, one of my students told me that she went for job interview at a particular big hospital in Lagos. And when she went there was a big panel there, and they just invited me. Well, Miss So and So, we got that with your CV, we found out that you studied physiology at Ladu Capital. It's somebody you know, but I've not mentioned the name. They studied physiology in physiology department, Lautech. And can you tell us reasons why we should give you this job? Do you know what the lady said? The lady said, well, as a physiologist, I have gone through several training. Number 1, I was trained by physiologists. With that, I built research experience. Also, I was trained by medical doctor as well, where I learned some of the research and practical knowledge as well. And also, I went for industrial training program, where I work with fellow physiologists, where I work with doctors. The man said, you got the job. Imagine if you had not gone through IT. So that's why I'm saying that IT is part of your work experience. She said, I have gone through IT. And during my IT, I did my IT in so places where I'm the one that handles ECG, EEG. I was the one, and I was trained. And after some time, I started managing people. In fact, throughout my industrial training program, I handled over 100 patients that is having this and this issue. So with this, if I'm permitted, if I'm able to get this job, I can assure you that I'll be able to I'll be able to apply my wealth of experience in this area to take the company to higher heights. The man said, you got the job. So nobody is recruiting. What people are interested in, what can you do? And that's why most times I tell my students that don't be much more concerned about physiology is not lucrative, physiology is not productive, this, that, they are saying this. No. What we should be much more concerned about is what are those opportunities that are available in physiology? Then let me sit down with it and build myself. such that when they need somebody, I will be the one that will be called upon. Not that by the time they are calling me, I don't know what to do. So that is it. So this sideways will add to our work experience. At that level, you will not be talking on the level of classroom experience, but rather you will be talking at the practical experience. What you have seen, you'll be able to analyze it properly, you'll be able to explain properly, you'll be able to apply. So that is one of the significance to career development. Then number 2 is what? Networking. I've had colleagues that are working in Ministry of Health today, and they said, the person that helped me, I met them during my IT, and they told me during my IT that no problem, that after I finish my BTech program, that I should come. And it was that network. And I think some months ago, I was sharing my experience with students that, so
Hello, sir. Can we see him? Or is it my network?
No.
It is network again. Let's be patient, please.
maybe 200 level students, I was telling them that networking, connect.
Hello, sir. Hello, sir. We can't hear you anymore.
Please, can you hear me?
Yes, sir.
Please, can you hear me?
Yes, sir. We can hear you, sir.
Yeah, thank you very
We
much.
can hear you, sir.
Thank you very much. So during sideways, you make connections that will be useful to us later. There are people that the opportunity they've gotten now in this program. Then also, you just handle it and you find out that you develop so much interest in that area. Then that will point to build you and increase your interest in that particular area. For example, I have a friend that where he had his IT, it was a military hospital in Ibadan, where he was exposed to all this ultrasound and the likes. At first, he said when he got there, was not even interested, but later it was someone said, no, you don't, that does not really mean this is how it's done, this is this probe, you can place it here. And When we came back, he said that he had this experience, he had that experience. We did not even listen to it. It was not until later on when we graduated, we now found out that this guy has become a sonologist, that different hospitals were now calling him. He was doing this. Today, that knowledge he got in that place has taken him to UK now. A serious program than some people will just go somewhere and say, let me just go and learn something. Let me just go and learn tailoring. And the person will not know that he has caused himself a disservice. But with the knowledge the guy got, it has taken him to UK. He first worked at, one private university, I think in Bangkok. From Bangkok, he moved to maybe Lasu. From there, he wrote professional course in that area, and he found himself in UK now, working in a particular hospital in UK. So it's aid career discovery. So, and also, finally, as I have also said, it also gives you an advantage because most organizations at times, they can ask, did you have any training before? Have you gone through any training before? You can say, yes, I've gone through industrial training. Where I've learned this, I've learned that. Then people will know that you have an holistic training. Then, finally, where can I look for placements? Number one, hospitals. You can get your placement in several hospitals. Then also in hospitals, different units, hematology unit, cardiology unit, reproductive unit, and endocrinology unit, renal unit, any unit that is directly linked to all the systems you are taught in physiology, you can seek placement in those places. Then you can work in pharmaceuticals and biotechnology units anywhere, like quality control, research and development department, anywhere they are doing research. Because research is conventional. Research cannot be squeezed. It is multidisciplinary. So any research and development center, you can work in the place. University research centers, medical research centers, institutes, you can work there. Then regulatory agencies, NAFDAC, NCDC, Primary Health Care Board, you can work there. You can work in diagnostic laboratories, both public and private. You can work in universities, health centers. You can work in physiology. You can do your IT also in physiology department too. Because there is a research aspect of physiology where you can be trained as well. Then also, how do I secure a good placement? How do we do that? We start doing that very early. We start early, months, weeks, looking for places. Because if you don't move out, nobody will move out for you. So you have to look for places. Then after that, you collect your letter of introduction from the department, and then you prepare short CV and application letter, and then you can use your personal network, your family, or your lecturer's network. Then you confirm the placement. Make sure that the placement covers relevant aspects in physiology. Hello, are you with me?
Yes, we are with you, sir.
Yes,
All
sir.
right. All right. All right. All right. Then always, and finally, make sure it is relevant to physiology. It must be. Then always have a backup plans. in case the first plan did not work. So it's not during that IT. That's when you now start saying, hey, you would have planned ahead. Months before that time, you would have looked for a place of interest, a place where you feel you have interest in it. You would have looked for look inward. This is my interest. Then you apply. And then different branches of physiology that you can explore. We have the general physiology. We have the respiratory physiology, spirometry, all that. You will learn how to use all those equipment to determine lung volume, a lot of things, that aspect is not much explored. Then we have the sport and exercise physiology. We have the neurophysiology aspect. We have the renal physiology. We have the comparative and environmental physiology. We have the cardiovascular physiology. We have the reproductive and endocrine physiology. Then we have the clinical physiology or pathophysiology. Because of our knowledge of physiology, it will be easier for us to understand pathophysiology, because physiology tells us normal, then patho abnormal. So before you know patho, you must first know the physiology first. So these are different branches, different areas where you can be gainfully employed, and as well you can also do your industrial training. So as a physiologist, with the training we have got, we can work in all this area, and at the same time, we can also design research in all of this area. So far, with my wealth of experience, I've designed research in reproductive and endocrinology physiology. I've designed research in neurophysiology. I've designed research in cardiovascular physiology so far. I've also designed work in environmental physiology. And I've also designed work in renal physiology, renal ischemia hyperphysiology. I've designed work in renal physiology too. So as a seasoned and trained physiology, there is no area or aspect of physiology you should not be able to work on. And that is where the area of second degree comes in. That is what we are trained at master's level to become a master in all these areas. So as you advance, you may now decide and say, okay, among all these areas, personally, I will be interested in working in this particular area. So that when they are saying they are looking for experts in reproductive physiology in this particular area of testicular ischemia reperfusion injury, I am the one that will come to people's mind. It is not as though I cannot work in other areas, but the more you are climbing up the ladder, you will want people to know you for one thing. And that is why at higher level that we are now, we now narrow everything we do to a particular area, so that when they are mentioning people in that area, you will become an authority in that area. People will also mention you because of your contribution so far to the field. So it is not as though we cannot design work or you cannot function in other area. And also it depends on your ability too and your interest. Some people may decide to limit themselves, but you can break yourself out of that yoke. Then there is no aspect or area where you not be able to function. Because this physiology, it is a physiologist that is meant to understand all these things. But the truth is that if you don't sit down and develop it and pick a particular interest and pay the price. I remember some years ago, because I had interest in research, I pay money to learn things. I paid the price. And those things are now working for me now. So these are different areas and aspects of physiology that we can explore, and we can make exploit. There's no exploit that we cannot make in all of this area. But one thing I want you to know is that, number one must look for a problem first in a particular area. What is the problem? Because you can't say you are doing a research without doing, because that's what people will ask you. So you first tell people there is a problem in this aspect. And this problem is endemic in the society. People are affected. You have to justify it. Because when you are bringing a problem and you are not able to convince people that people are faced with that problem, the people will see, no, they will not want to look into it. So there is a problem. This is what is going on. Then I now have a solution. Then from that branches of physiology that I've explained, shown you earlier, then possible placement during CWES, cardiovascular and respiratory physiology. You can work in cardiology unit, pulmonary unit, all right, where you have access to all those equipment, EEG, a spirometry lab. You have access to spirometry lab, where a lot of equipment that you are taught in respiratory physiology, you will have access to those equipment. You will have access to those equipment that probably should have been, that you are shown, or probably some of them are not shown. You have access to those equipment, and you'll be trained there on how to use them. So with that knowledge, anywhere you go, you'll be able to say it boldly that I can do this, I can do that, I can do this, I can do that. Then also, endocrine and reproductive unit. In endocrine unit, you'll be trained on how to assay. You can work in hormone assay lab, where you can assay for different hormones. Then you can work in reproductive physiology. You can work in fertility clinic as well. All these fertility clinic, all these procedure for IVF, you can be trained in such area where people come to you as consultants. Because we are trained to be a researcher, and a researcher is a frontier. Please, are you with me?
Yes, sir.
Yes,
Please, are you with
we are
me?
with you, sir.
A
We are
researcher,
with you, sir.
thank you. A researcher is the one that excavates the ground for others. He's the one that excavates the ground before others will start planting. So please, I'm waking us up to understand who we are. Because some of us, we don't know who we are. It is that notion that people have put on our head that there's nothing. No, we are the ones that we are the major. All right, because it is when I come up with, when there is a problem and I provide a solution to it, that's why we say, they said if I drink this thing, it will solve this problem. Oh, different people will now come to you. Doctor, we hear that you are working on this, and it is working. Please, we want to collaborate with you. We want to do clinical trial. Clinical trial is like we want to take it to the hospital and test it for some people there to confirm it will work and all that. So all of these things we can work in fertility clinic. Then chemical pathology has to do with biochemical analysis of body fluid to diagnose, monitor, and treat disease. So we can in chemical pathology, what they do is that they pick body fluid like blood, like urine, and they can run several tests on it to diagnose what is wrong with somebody, and at the same time, what probably after they have treated the person, they check again. Then neurophysiology, EEG, MOG unit, neurology department, anything that has to do with brain, a lot of equipment that are there that can be used to actually that we can train in those areas and we become an authority in that area. Then we also have exercise physiology, where we have sports science, fitness centers, where you can train people. Then we have renal units too, where you can learn how to use a dialysis machine, where you can use that to the dialyzer, what's it called, where you use that to for people with renal failure. You can actually be trained in that area, and at the same time you can also develop a diet. You can be a consultant to those people that these are the kind of things you can be eating. You cannot eat this, so because of the condition of your kidney, this is what you can do. This is you can be a consultant to people in that area. But before you can do that, you must have been garnished, you must have been trained, you must be seasoned. You must know the practical before you can take it further to another level. All right. So then you can work in medical laboratories, diagnostic centers. You can do your IT in Ministry of Health and all that. So the opportunities are there. It is meant for us to explore. Another says curiosity is what turns exposure into learning. Let us be curious to learn. Somebody says curiosity is the mother of invention. Professionalism pays off at your next application. Nobody wants to employ somebody that is not professional. Nobody wants to employ somebody that does not have the practical experience, because what the world listens to is what? The practical experience. Please, do I still have time? Because I'm already rounding up. Hello?
Hello, sir. Yes, sir. We are in the question and answer session now, sir. You can round up, sir.
All right. Thank you very much. So people need those that will solve their problem. That's what people want to know. So what am I saying in short is IT is not meant to be played with. It is part of what determines your career progression. And what will IT do? What IT will do is that it will help you to gather practical experience that will serve as a bridge to draw the theoretical knowledge, mix it with practical, and it will now help you to solve a particular problem in the future. That will help you to solve a particular problem. And in the attempt of solving that problem, you develop interest, you explore more, and you become an authority in that particular area. So that is what IT will do. And it will now go down in your experience. It builds your CV network and give you your identity. So thank you very much.
Thank you so much, sir, for this insightful presentation. As someone who is currently undergoing IT program, I could relate to a lot of the points you shared today, sir. It has been an eye-opener, and thank you so much for the presentation once again, sir.
You are welcome, madam. Thank you so much. You are welcome.
Yes, sir. So we are in the question and answer session. Please, if you have
No
any
problem.
question, I know we do. Please write it in the chat box so that I can read it out.
Yeah, you are welcome.
So, someone asks that, is it necessary the hospital is a teaching hospital?
Wow, it's not necessary. It can be any hospital. There is nowhere that you cannot have knowledge. There is nowhere we cannot be trained. What is more important is one's mindset. Most times, great things comes out from a small place. People say, this place is, such a big thing cannot come out from this small place. So it does not necessarily mean to be a teaching hospital. It can be as little as health center. That may be what will take you out of the world. You can get the experience from health center. In fact, one of my friends during service in a particular village, that was where he developed something that took him out globally. So there's no place where you cannot gather knowledge. But what is more important is anywhere you get to, recognize a problem directly, that is direct to your field, directly or indirectly. And the good part of it is that research or anything we are doing is multidisciplinary. So somebody can collaborate. Are you getting it? We can collaborate with other area too. Maybe a friend of mine is in chemistry and there is an interface between chemistry and physiology. We can sit together, or in engineering, we can sit together and say, okay, this is the idea I have. What have you got? We marry it together. That was what the guy did. He just got an information that in those days people die in villages, remote area. He said to his eyes like these people are dying. He now developed an application. He called it Baby Me Godin. He now collaborated with an engineering student. So they now designed an application that even if you're in the remote area, you can, once you download it, you have access to that information. Then you can ask question. If I'm going through labor in different language, what should I do? If I suddenly see blood coming out of my body, what should I do? Okay, do this, do that. Do you get it? So that has saved a lot of life. That he won a lot of recognition virtually everywhere. So you can anywhere. Knowledge is everywhere. We have to see it and tap into it. So I hope I have answered that question.
All right, sir. Thank you so much, sir. So the second question is, but why is it that in hospitals nowadays they are rejecting IT students? For example, lawsuits.
Okay. All right. They are rejecting IT students in lawsuit. Because I have, okay, is it just recently or it has always been like that?
The person did not specify. Can you please specify?
Please, can you speak further? Because I have a lot of friends of mine that had their IT at lawsuit, and in those days, and they were not actually rejected. Where?
It is recently, sir. It is recently, sir.
Well, because we have a LabTech teaching hospital here, we have a UI there, University of Ibadan teaching hospital. Then we have Unilori teaching hospital. They don't reject IT students. They don't reject, and some other hospitals too. So the reason for that may be due to internal infighting that is going on there. That may be the reason. So there is no way why a particular teaching hospital will reject CWES IT students. In fact, I've not really heard of such, but I'm surprised that I'm just hearing this. It may be as a result of maybe this internal rancor within the system, because it's also part of their training too. Teaching hospital, they are to teach and train too. That is why they call them teaching hospital. Any hospital that is not teaching, because teaching hospital, they are meant to train and teach. So that's why they are called teaching hospital. So it may be as a result of internal mechanism in such hospital. UCH is training people till tomorrow. After teaching hospital too, they are training people. Learning to their training. A lot of teaching hospital too, they are training students. So it may be a rancor or internal rancor within the system that is causing that. Because it's part of their mandate.
Okay, sir. Thank you, sir.
All right, sir. Thank you, sir. Samuel Jesoloba, I can see your hand. Kindly unmute yourself.
Okay. Thank you very much for this opportunity. My name is Samuel Jesoloba from Adukektola University of Technology. A very big thanks to Dr. Ajike. Thank you for that impactful
Abuja
section.
Teaching Hospital to their internal mechanism probably that is causing that within the system.
I really do appreciate. So now my question is, can we all hear me?
Yes, we can hear you.
Okay. Now my question is, you talked about exercise physiology, and I know quite number of my colleagues that they are doing their assignments currently in a gym.
All right.
Is it gym center? Should I call it gym center? So my question is that facility a good place for someone to undergo CWES, someone that wants to specialize on exercise physiology? Because I know exercise physiology is basically what the body is doing during exercise, if I'm not mistaken. So is that I know in gym center what they do is to build body. I don't know if that is like a compatible environment for such person who want to venture into exercise physiology, or is there any other facilities that someone can actually do sideways?
Wow. Yeah. Thank you for that question. I would say that exercise physiology is also a good area where we can do that. Then the gym center and the likes, they are wonderful area. But what is important here is a series of equipment available in those places. That is very, very important. So in a place where you have series of equipment and you are trained properly on how to use it to develop different aspects, to how to build muscle and build a particular physique that your customer wants. I think that is what it is all about. And not only that, to recommend. And not only that, to recommend diet. That concerning this is what you do. When you want to build this, these are the procedure for you to build this particular muscle, achieve this. Are you getting it? So that is what we to practical. To the point of even telling us that if you want to build this particular part of your body, this is what you do. So it is a good area and good aspect. Because sports physiology is like a twin sister to physiotherapy. I mean the fitness and the likes. Because physiotherapy, they are using physical therapy to actually treat a particular condition. They are using physical means to treat a particular condition. In some football clubs, the expertise of a sports physiologist is needed. But what will now determine is how good are you in that area? Because we have to convince people. For example, you have to convince people that you have this skill before they take you in. So it is actually a good area. But it's not all about brandishing it that I've done it in gym. It's all about what you can do. Can you convince me that if I want my chest to build to a particular level, you manage me and you will produce that physique inside of me? So it's the practicality of that thing and bringing it to reality, that is what matters. So it is a good area. Yes, somebody can build his career. And with time too, you can take it further to the point of recommending diet. This is the kind of food you eat when you want to have this shape. This is the kind of thing you don't eat when you want to build yourself in this area or in this part of the body. So I hope I've answered that question. So it's a good area that we can explore, that there are a lot of potentials there to explore.
All right, sir. Thank you so much, sir. Adewale Precious Elizabeth, I can see your hand raised. Kindly unmute yourself.
All right, thank you so much. And thank you so
Well,
much, Dr. My name is
well,
Precious
all
from
right.
University of Technology, and I have a particular question to ask. So my question is, aside CWES, which is actually an academic requirement, what other deliberate action do you think students should adopt, even before the program, during the program, and after the program, in order for them to like transform the opportunity into a very big platform for a long-term career growth? Because right now, to be very realistic, I'm not speaking for myself, but other people
Okay.
which really don't want to go through that long process to achieve their aim, or to do something long term. And also, most people don't even see this career as a like most people don't see their path as a way of making money and all that. Some people don't want to make money though, but they don't want to go through that process. So what, aside CWES, which is actually an academic requirement, what other actions do you think students can take? Thank you, sir.
Yeah, thank you very much. The number one step that you can take is, number one, changing our mindsets. I've said this several. In fact, when someone like me, I was coming up, people said, physiology does not have future. It does not have hope. This is gloomy. Nothing will come out of it. I now met with one Dr. Kenny Olani that time. I think then I was in 100 level, we graduated. Dr. Kenny Olani, I think, is in one university in Ocean State University. And I met him, sir, what I'm hearing about this physiology, people said it's gloomy, it's not productive. He now gave me orientation. That stop listening to what people are saying. You change your mindset. He now gave me examples of physiologists that are doing fine. Then my mindset changed. And I know with this, I'm going to places. So the first thing is what? Change your mindset. That is number one. By the time you change your mindset, your eyes will open to see a particular area of that physiology that needs your own personal attention. Let me give you this. Do you know that as I was going, I started developing interest in research. And I met with somebody, said, wow, research is a good area, because it's like is the foundation of everything we are doing. The person started training me, I was paying the price. I took it to UI. That experience, I was working, doing everything I should do. When I was about to finish my MSc program, somebody just reached out to me that he could see that I had a vast knowledge in research, that his brother is in the United States of America, that needs my assistance. Then the person reached out to me, and the person said, somebody introduced me to him. So what am I saying? If you devote your time to a particular thing, your attention, your professionalism will be needed one day. But the point is that if we don't have the correct mindset and we don't make ourselves available, when that need is needed, we will not be able to provide that thing that is needed. The person needed a good researcher. They said, this person is a good researcher. He will address anything. And then the lady said, can he give the person my number. I said, give it to him. The person called me, and I was able to convince him beyond every reasonable doubt that I can do the job. That's something that mindset and some other things that will aid that mindset and some other things that will bring you out and create something in you that you'll be able to convince people that if you are not the one they are taking, there's no other person that will be able to do it. Now they say that, okay, this is cardiovascular physiology. We need an expert in that aspect. You will only be picked if you've got training in that aspect and you're able to convince people beyond every reasonable doubt. Convince people beyond every reasonable doubt that you are the best for the job. So there's no shortcut to it. There are a lot of opportunities in this area, in this physiology. In fact, the opportunity is so much that cannot be explored completely. But it is we that we sit down, pick a particular area. But do you now know the beauty part of it? The most interesting part of it is that once you are able to build yourself in a particular area, it is interconnected. You'll be able to connect other areas to what you are doing. That now make you a consultant. So our mindset must change. And that aspect has to do with you seeing it that there is future in this thing. You seeing it that you own this physiology. I used to tell people that I don't envy doctors. Why will I envy a medical doctor? I am doing my own, they are doing their own. So what I should be doing is, what are those things I should be doing as a physiologist that will give me my relevance? Sit down, develop my own teaching skill, take physiology close to the heart of people. When people listen to me, they see reality of physiology. Sit down and write paper, mobilize resources, mobilize people to write paper. In fact, was it not late last year? I saw a paper, a particular organization saw my paper online, and they invited me that I should come and give a talk. But I was not able to raise the money. They said maybe $3,000 or something. We begged, we wrote to them that here in Nigeria, the money is much. You cannot afford it, that they should reduce it. They said they can only reduce it to $1,500. And that was when dollars was increased. So I could not raise the money. And I wrote to the university, but before they go to this place, go to that place, we were not able to meet up the deadline. But I was happy that somebody could see the paper we have written here, and they could see us. So this training, it takes time before people will hear your voice. But let us start from somewhere. Don't let us be in haste. This mindset of get rich quick syndrome will not take us anywhere. We must start from somewhere. 5 years ago, this Japanese man that brought up the concept of autophagy, how the body expels harmful substance from the body. That man, a Japanese man, he has been working on that project for the past 30 years. They now recognize him in 2020. So we are deceiving ourselves. We think we will just glow, boom, overnight. It's not going to work. We must sit down, work very hard, change our mindset, read different books, apart from even physiology, that will change our mindset. Once our mindset is changed, the sky is our starting point. Even till today, I keep on working. I want my voice to be heard on this testicular ischemic reperfusion injury that is my area. That when they are saying testicular ischemic reperfusion injury, what will come to people's mind is Dr. Ajikeri Chayedamola in Lautech. So if that will happen, I must continue working. Not that I will just sit down in the exam office and that I'm only typing system all the time. After typing system, I must go to my office and work overnight, day and night. Not until I will work and people will say, wow, this man has done extremely a lot of work concerning. Anytime we want to work on ischemic reperfusion injury. In fact, now that I'm working, a lot of people are calling me. They want me to review this. They want me to review that. They want me, is an indication, which I was not receiving before. So it's an indication that People are beginning to see what I'm doing. But what should I do? I should not rest on my oars. I should continue until breakthrough will come. So please, the way forward is we should continue our mindset and we should continue directing our effort towards that one thing until breakthrough will come. In academics or in everything we are doing, this mindset of get rich quick syndrome will not help us. So that is what I want to say concerning it.
Thank you so much, sir. And the last question, someone asked that, does
You're
doing
welcome.
IT in the university physiology department where practicals are carried out advisable, and does it limit one to certain career opportunities? Should I take that again, sir?
Yes, I got that question. Thank you.
Okay, sir.
There's nothing bad. In fact, I think some years ago, the university, I think it's still in existence, but here in LabTech, that structure was designed for people to, so some of the best students to do their IT in the department. And this was how it was actually structured. Number one, departmental animal house was part of the plan. And the reason why it was incorporated is that they believe in that particular area will be trained on how to use experimental rat to conduct research. Because why we use it is because it has the same physiology as humans. So anything that is tested, the result is very close to what you see in humans. So they allow people to do IT in that area where they will gather experience for maybe 2 months, they will be there. Then also, University Health Center. So they say, okay, after you have spent 2 months in animals, so go to University Health Center. At the University Health Center, a lot of equipment there that you can learn. All these gym and likes, you'll be taught sport physiology, all this lab too. There is a lab there where you will be trained on how to use some of those equipment and all that.
Thank you so much, sir. Thank you so much. That brings us to the end of today's webinar. On behalf of the Student Physiological Association of Nigeria, the Southwest Region Zone D, I'd like to sincerely thank our distinguished speakers for honoring our invitation and also sharing their wealth of knowledge and experience with us. With this, we look forward to having you join us tomorrow. Thank you so much, everyone, and do have a wonderful night. Thank you so much, sir.
We can leave the call. We don't want to leave call. I mean, some of you have slept off.